What we're doing, the official name is Wastewater-based epidemiology, and what we're doing is testing for the presence of COVID-19 in sewage, essentially, from dorms around campus, and we're also testing from wastewater plants all over Colorado. I'm Carol Willis. I am a professor in the microbiology, immunology and pathology department. I'm also the director of the molecular quantification core. What we're looking for is the presence of COVID-19 as an early warning for increased infection rates. The samples come in these 50 ml tubes. We have, I think, teams of 2 students and a consultant go around 17 manholes. They start at like 6 in the morning and they're usually here by noon or 1 o'clock.
I'm Tom Anderson. I'm a civil engineering student here at CSU. We do sample 3 times a week. So after having set up the sampler, we take it out of the sewer and we extract the sample. We move the sample into a smaller bottle, and from there take about 1,500 mils of that sample. Yeah, we keep that on ice, reassemble everything, and deliver it to the lab.
So we stored here at 4 degrees.
My name is August Luke. I am a lab technician here. We use a thing called an ANOVA prep, which is a way of using various buffers and further filtration to reduce it down to what's hopefully most likely to be viral content. And then you take that RNA, and we're what I'm doing right now, which is introducing a number of fluorescent probes and primers. We turn that into little droplets that contain each of those reactions. Those get amplified within a PCR machine and then moved over to a droplet reader, and then we get a number that correlates to an amount of viral content.
And so we have all these positive controls and also negative controls to make sure that we didn't accidentally contaminate one sample with another sample. Once we've gone through and checked all of those controls, we can report the data. What we're looking for is, for probably most of the time, we want the level to be around our limit of detection or lower. These tests are not cheap. We're charging the state of Colorado $250 per sample. But with those samples, we're testing like 50,000 to 100,000 people. And we started work on the project probably mid to late May. Susan DeLong knows a lot about working with environmental samples, so she was really helpful. We reached out to some other places that were using digital PCR for this, and they were willing to share their protocols with us. It's really been a big team of people involved in getting this together. I mean, the Colorado Department of Public Health is funding the state project, but because they funded the state project, that enabled us to get the momentum to get going and be ready for testing by the time the students came back in the fall. We've yet to see anything that we're really like, yeah, we've got to move on that, but I think we have it all up and running. We're confident we're getting good results. So.